Hi, my name is Michael Uy, and today I will be discussing what oral antidiabetics are. I will describe what it treats, what body systems are involved, two examples of the antidiabetics, how it works, how it can be administered, any possible side or adverse effects, what to educate the patient about in regards to the medication, what to do before, during, and after administration, and when the prescriber should be notified. Anti-diabetic drugs are medications to help people with type 1 and type 2 diabetes mellitus. Anti-diabetic drugs work by controlling the glucose and insulin levels. Today, I will be talking about drugs to help treat patients with type 2 diabetes mellitus, specifically type 2 patients who have not responded to exercise, diet, and other treatment methods. The four different types of anti-diabetic drugs include sulfonylureas, metformin, thiazolidinediones, and alpha-glucosidase inhibitors. Sulfonylureas is the most widely used drug for type 2 diabetes and stimulates insulin secretion. Sulfonylureas generally lowers blood glucose levels and are most effective for patients whose weight is normal or slightly increased. Metformin mainly works to increase the action of insulin and does not aid in insulin secretion. Thiazolidinediones reverses insulin resistance by acting on muscles, fat, and to a lesser extent liver to increase glucose utilization and diminish glucose production. Lastly, alpha-glucosidase inhibitors inhibits the enzymes that convert starch and other complex carbohydrates into simple sugars. The main goal is to slow the absorption of glucose after meals. First, it is important to know what diabetes is and how it affects the body. Before knowing what antibiotics do and how it can help with these disorders, I will explain what diabetes is. Type 1 diabetes mainly affects the immune system and therefore is an immune system disorder. The immune system in type 1 diabetes attacks the cells in the pancreas that produce insulin, which prevents the body from producing insulin. People with type 1 diabetes must take insulin in order to live and are diagnosed either as a child or as a young adult. Type 2 diabetes, on the other hand, is related to resistance of insulin. This can be due to poor dieting, poor lifestyle, and lack of exercise. In type 2 diabetes, the pancreas stops using insulin effectively, which can cause issues with the ability to extract sugar from the blood and put it into cells for energy. Other body systems, such as the circulatory, integumentary, and central nervous systems, are affected from diabetes as well. Diabetes can affect the skin due to high blood sugar and lack of moisture. This causes the skin on the feet to become dry and crack. Diabetes affects the circulatory system because you also develop high blood pressure, which puts more strain on your heart. High blood glucose levels can also contribute to the formation of fatty deposits on the walls of the blood vessels. Lastly, diabetes affects the central nervous systems by causing diabetic neuropathy, which affects perception of heat, cold, and pain. Oral antidiabetics are meant to control the blood glucose levels in order to prevent any problems in any of these body systems. When administering medications to a patient who has type 2 diabetes, it is important to know what each drug does and how it affects the body. One medication for antidiabetics is glipizide. Glipizide is a medication that falls under the class of sulfonylureas, so the main goal of the medication is to improve the production of insulin in the body. Glipizide lowers blood glucose levels by stimulating insulin secretion from the beta cells in the pancreas. This action is dependent on the functionality of the beta cells in the pancreas, and is only effective for people with type 2 diabetes and not type 1. Like glipizide, metformin, is only for people who have type 2 diabetes mellitus. Metformin is a medication that falls under the class of biguanides, so the main goal of this medication is to enhance the effect of insulin and to reduce hepatic glucose levels and increase uptake of glucose by the periphery. I will now talk about the mechanism of action for both glipizide and metformin. This means how both the medications work on a molecular level. Glipizide is a secretagogue that works by stimulating insulin release from the pancreatic beta cells. Doing this increases the plasma concentration of insulin. Due to this, the effectiveness of glipizide depends on the functional beta cells in the pancreas islets. The way that glipizide works, more specifically sulfonylureas, is by binding sulfonylurea receptors that is expressed on the pancreatic beta cell plasma membrane. This leads to the closure of the ATP-sensitive potassium channel and reduces the conductance of potassium. This results in the depolarization of the pancreatic beta cells and opens the voltage-sensitive calcium channels, which promotes calcium ion influx. Increased calcium ions in the beta cells stimulates the secretion of insulin from the cells. Next up is metformin. Metformin is an anti-hyperglycemic agent that belongs to the biguanide class, which is used for type 2 diabetes. Metformin decreases blood glucose levels by decreasing hepatic glucose production. After ingestion, the organic cation transporter is responsible for the uptake of metformin into hepatocytes. Metformin inhibits mitochondrial complex, preventing the production of mitochondrial ATP, leading to increased cytoplasmic ADP-ATP and AMP to ATP ratios. These changes causes the activation of AMP-activated protein kinase, which is an enzyme that regulates glucose metabolism. In the intestines, metformin increases anaerobic metabolism in enterocytes, which leads to reduced net glucose uptake and increased delivery of lactate to the liver. Some of the ways metformin may play a role in the intestines is by promoting the metabolism of glucose by increasing glucagon-like peptide, as well as increasing gut utilization of glucose. Metformin can be administered via a solution, tablets, or an extended release tablet. Metformin should be taken with meals as to reduce stomach or bowel discomfort. For the tablet or the extended release tablet, it is important that the tablet is swallowed whole and not crushed or chewed. When taking the extended release tablet, it is normal for part of the tablet to be present in the stool. For the liquid, measure the liquid with a marked measuring spoon, oral syringe, or medicine cup. Glipizide has the option to be taken via tablet or liquid as well, so the same procedure for administration is the same for metformin and glipizide. When administering metformin or glipizide to a patient, it is important to know the possible side or adverse effects of the medication. In regards to metformin, possible side effects may include constipation, diarrhea, cramping, or physical weakness. It is important to inform the patient about these side effects so that if they feel like anything is wrong, that they should contact their primary care provider. It is also important to educate the patient about the medication that they are about to take. For metformin, you might include why they are taking the medication and how it should be used. Metformin is prescribed for patients with type 2 diabetes mellitus and will increase the body's response to insulin. Metformin comes as a liquid, tablet, and extended release tablet. You should inform the patient to take the liquid form with a meal 1 to 2 times a day, and that the regular tablet is taken with meals as well, but this time is 2 to 3 times a day. They should know that the tablet must be taken whole and not chewed, broken, or split. Any possible side effects for glipizide includes constipation, dizziness, and diarrhea. It is important to let the patient know that this type of medication is used alongside diet and exercise. This type of medication is only for patients who naturally produce insulin, and the main goal of it is to lower blood sugar levels. Glipizide only comes in tablets and extended release tablets. The regular tablet is taken 2 to 3 times a day, and either 30 minutes before or after meals. For extended release tablets, this is taken once a day with breakfast. Before administering any type of medication, it is important to check if the patient is allergic to the medication. Before administering metformin, it is important that the patient knows the risk factors for this particular drug. This is something that the provider and the patient go over together. If they agree to receive this medication, their vital signs must be checked before administration. Doing so can establish a baseline of what their normal vitals may be. After administration, it is important to check their vitals again, as a few of the side effects may be fever, chills, fast or irregular heartbeats, etc. Labs that should be monitored include their serum glucose and glycosylated hemoglobin. If metformin-associated lactic acidosis is suspected, immediately discontinue the use of metformin. Before administering glipizide, inform the patient that this medication can cause the skin to be sensitive to sunlight. Therefore, they would have to wear protective clothing and sunscreen. Vital signs should also be taken so that any abnormalities can be detected, if any, after the administration of the medication. Some labs to look out for is their serum glucose level and glycosylated hemoglobin. CBC should also be monitored, and any decrease in red blood cell count should be reported promptly. After administration, vitals should be taken again to see if any noticeable fluctuations in their vitals, as having a fever while receiving this medication can be dangerous. Also, if any signs of low blood sugar arise, notify the provider. The provider should be notified if any allergic reaction occurs. This can be due to the patient not knowing that they are allergic and only now experiencing a reaction after being put on the medication. Any allergic reaction while on metformin or glipizide can be lethal. If there is ineffectiveness in the medication, meaning that the medication has not been helpful to the patient, then the prescriber must be notified in order to try another solution. If the patient is refusing treatment, then the prescriber is to be contacted. Here they may discuss a form of medication that is more acceptable if they do not like taking tablets. They also may be refusing treatment because they know that they will have an allergic reaction to the medication. If there is an interference with another medication, this can be potentially harmful for the patient. It might not always be harmful, however, they are still at risk regardless. Lastly, is any adverse side effects. Adverse side effects are particularly harmful to the patient, and if any adverse side effects are suspected, the prescriber must be contacted immediately. That concludes this presentation, and thank you for watching.